at all. You are pressing, there is no tenderness. He's not feeling any pain. What is this? Any idea? So this is our Charcot joint. This is our Charcot joint. Okay. This Charcot joint, if they're asking you treatment, and there is a question from your treatment, because there is no pharmacological treatment. That's why it is one of your part 1 question also. The treatment is you just have to bandage. I mean, you just have to give him immobility treatment. Tell him to not to move that joint for 3 to 6 months. So immobility for 3 to 6 months. So if there is any joint with gross destruction, okay, I am coming, inshallah. So if any joint like grossly distracted, okay, so that one is your Charcot joint with no actually that was a part 2 question. That in the part 2 question they told that there is low pain. They in the score they told 2 slight pain, but for part 1 I didn't get. They will not confuse you, so let me not confuse you more. There is usually no pain for you guys. The question they will tell you no pain, no tenderness, but there is gross destruction. There is like X-ray you did, and you got shocked. What happened? And there is no history of fracture. He didn't tripped over. He didn't have any trauma. So this is your Charcot joint. This is your Charcot joint. Okay. So this is the thing. Okay. So someone asked Dr. Obeys, you asked me, D core vein, that tenosynovitis, pain at the base of the thumb. Okay. This one already actually in lecture we have discussed, and this one I experienced myself with this. Okay. So this is already you have told what you should know, that the pain is at the base of the thumb. The pain is at the base of the thumb. Okay. And usually this is because of overuse of anything. Like I had this pain because of overuse of computer. Okay. So sometimes the question is coming with piano, who are playing piano, or who are using an instrument, using hand more, musician, or who are using computer. Okay. So overusing of this joint, there is pain at the base of the thumb. That is the dequervine tenosynovitis. Okay. I think we have this also here. If I can show you the picture. This one. So no picture actually here. So this is, as I told you, that is overuse. Because of overuse, this is usually having. Okay. So base of the thumb. Base of the thumb. So where it is actually radial side of the wrist. So usually they are marking the point. I mean, they're describing the point, that the base of the thumb. There is one test, that is the Finkelstein test. So actually from here, you cannot understand this. I will show you from there. The picture is not there. I will just show you because I cannot show you by myself. So let me. This is the picture. I think in my lecture already I have showed you. So if you are doing like that, if you are just putting your thumb and doing like ulnar deviation, this is the Finkelstein test, the pain will be more. The pain will be more. You see the upper picture, it didn't have pain. When they are doing the ulnar deviated, you are moving your hand, fist to the ulnar part. That time, the pain is increased so much. What is the treatment? Actually, the first treatment is just to give rest to that joint. Don't move. Don't overuse that joint. Okay. So this is the first treatment, that you should not go for any kind of immobility. If there is in your management that immobility, go for the immobility first. Okay. Then yes, if they are asking you, there is painkiller. Steroid injection actually at the last stage, and for you guys, for part 1, they will not go up to the steroid injection, because this is after using all of these, if not even improve that time steroid injection. And usually the first thing, though it is written like that, if immobilization is there, this is your first line. So in your question, if management, they're asking what is the management? Immobilization. Number 2, analgesia. Yes. Steroid or surgical, this is if not improved. But up to this 3rd stage, steroid or surgical, they will not go for your part 1. So if you just know that, for me also, I stopped working for 2 days. So I forgot how many days. But not stopped, I minimized my work and using that hand, though it was very difficult because I was at the right hand actually, as I'm right-handed person. So I was using my right hand more while typing, because in our emergency, we have to type very, 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 very rapidly while seeing emergency patient. So that's why I was using that thumb mostly. So I try to minimize that use of my that specific joint. And yes, after a few days, I don't remember how many days, I recovered. So it's okay. And paracetamol, maybe 1 or 2 days I took. That's it. It improved. So why I'm telling you my story, so you will not forget. You will not forget. Okay, that Dr. Tanya did have this. So let's answer it. Jump to it. Okay. So this is the thing. Okay. Yes, one important question I want to tell you that day. Now, I want to ask you, you know about reactive arthritis, all of you, I think. This is very reactive arthritis, right? Now, I am giving you a scenario, okay? The patient came, the same like reactive arthritis patient. I mean, he will, in the scenario, I'm giving you, like he's having urethritis and he's having right knee joint swelling and also the red eyes, okay? Red eyes. And now they found out, they did a test and they found that there is chlamydia, okay? Chlamydia is the cause behind this reactive arthritis. So this is post-STI, right? Post-sexually transmitted infection by chlamydia. This is not my question. The question is, now, what should be your treatment? Reactive arthritis done by chlamydia. What should be your
doxycycline?
Doxycycline, very good. Now, reactive arthritis, same feature I'm giving you, sign symptoms same. The patient came actually with post-diarrhea. They did stool. That time they found salmonella. Because this diarrhea was before 1 week. It is subsided already. The diarrhea is not there. Listen to the scenario very carefully. The patient has diarrhea before 1 week. They found that time salmonella. It was treated. Now he arrived with the sign symptoms, same as I told you, urethritis, arthritis, and there is red eye. Now what should be your treatment?
Symptomatic treatment.
Symptomatic, yes. You will give painkiller, analgesic, NSAID. Not treat the salmonella. So the summary is that reactive arthritis, the main treatment actually, the symptomatic, the painkiller, go for NSAID. If not, yes, sometimes they're going for DMARDs, methotrexate sulfasalazine. That is step up. But up to this, you don't have to go actually. This is normal treatment of reactive arthritis. Only exceptional that if they are telling you there is chlamydia. Chlamydia, you need to treat. Even because there is already urethritis. So it is active. It is active, right? So this chlamydia only, yes, you need antibiotic toxicity. Other than that, never ever use antibiotic in any case of reactive arthritis. Is it clear?
Yes, ma'am.
Okay.